Hello everyone, it's Dr. YouTube here. Today's episode will be all about how to conduct the cardiovascular examination, um, where Dr. YouTube, myself, I upload regular educational videos. Please visit my website at medicsforyou.webs.com. That's MEDICS for you.webs.com. Let's start. Click on Aussie Exam and search cardiovascular examination. So, what is the first thing to do? Well, always wash your hands, especially during this COVID epidemic. Next, um, introduce yourself to the patient. Hello, I'm Dr. YouTube. Obtain consent. I'd like to perform a cardiovascular examination that involves me having a look, listen, and feel of your chest, and also having a feel of your pulses. Would that be all right? After obtaining consent, observe the patient from the bedside. Is the patient looking comfortable or uncomfortable? Always start from the hands and upwards, as so. Look at the hands. Are there any cigarette stains? Any clubbing? Clubbing could be a sign of endocarditis or cyanotic heart disease. And then also feel for the fingertips. What is the capillary refill time? It should be less than 2 seconds. Feel for radial pulse. Is it regular or irregular? What is the rate? Do it for about 15 seconds. Times 4 to obtain the heart rate at 60 seconds. You could also feel for a radial delay and also a radiofemoral delay, which could be present in aortic coarctation, in Turner syndrome, for example. At the palms, you could also feel for whether or not there's palmarothema, which could be a sign of hyperdynamic circulation, in sepsis, for example. Moving from the hands upwards, you could check for blood pressure reading, and finally to the neck. At the neck, there you could examine for the jugular venous pressure. So that is clubbing. Okay, again, and this is the jugular venous pressure, the pressure of the internal jugular vein, which should be, if you measure it from the sternal angle to the height of the maximum jugular venous pressure, should be less than 3 centimeters. Anything above that, especially if more than 5 centimeters, could be a sign of heart failure. You could try and elicit this by performing the hepatojugular reflex, placing your hand in the right costal margin and observe for any elevation in the JVP. For example, it might be there to begin with, but when you press your hand on the right costal margin, it could increase to there. Next, from the neck, look at the eyes. Are there any signs of hyperlipidemia, like xanthelasma or corneal arcus? Look at the face. Is there a malar flush, which could be present in a mitral stenosis? Look at the tongue. Is there central cyanosis? Look at the dentition. If poor, could be a risk factor for infective endocarditis. Finally, start with the chest. Chest inspection is crucial. Obviously, obtain consent from the patient to expose the chest. Start by observing, are there any scars, like a pacemaker site, typically located just below the left clavicle? Are there any scars, swellings, or asymmetry? Are there any obvious chest deformity? For example, in Marfan's, you could have a pigeon's chest as well. Inspection, palpation. So place your hand on the apex to feel for the apex beat at the mid clavicular line in the fifth intercostal splice. Is it displaced, which could be a sign of left ventricular hypertrophy? Hands on either sternum. If a heave is felt, it could be a sign of heart strain, and feel for thrills. And finally, auscultate. I won't go through the in detailed the uh, cardiac murmurs in detail. However, it's important that what is normal first. So S1 should be lub, which is basically closure of the mitral and tricuspid valve, and S2 dub, which is closure of the aortic and pulmonary valve. So it should be something like this: lub dub, lub dub. Okay, so between S1 and S2 is the systolic phase, and from S2 to S1 is the diastolic phase. It's important that you present your findings in a methodical manner, and there are some keywords to know. The systolic murmurs in the exams are pretty much always aortic stenosis or mitral regurg. For diastolic murmur, it's almost always aortic regurgitation or mitral stenosis. As I said, there are some keywords to remember. Aortic stenosis is probably the most common murmur that we encountered in clinical practice. So, key point here is mid-systolic murmur, crescendo, decrescendo murmur with radiation to the carotids. So that's systolic murmur. For another systolic murmur, it's mitral regurg. It is a pansystolic murmur, best heard in the mitral area with radiation to the axilla. The aortic stenosis is a crescendo decrescendo, so it's something like this. Ooh, 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 ooh. For micro regurgitation, it's a blowing murmur, pansystolic. Aortic stenosis, ooh, ooh. Mitral regurg. Finally, we'll go through the diastolic murmur. Aortic regurgitation is an early diastolic murmur, typically associated with a collapsing beat. And for the mitral stenosis, it's a mid-diastolic murmur with an opening snap. So remember these keywords. Let's quickly recap. Start with the hands. Are there any clubbing, indicative of cyanotic heart disease, endocarditis, cigarette stains, capillary field time, the radial pulse, radial delay, radiofemoral delay. Check the blood pressure. Observe the jugular venous pressure. Elicit the hepatojugular reflex. Look at the eyes. Corneal arcus, xanthelasma. Look at the mouth. Central stenosis or poor dentition. Look at the chest. Any scars, swellings, asymmetry, especially for the pacemaker site. Palpate for any displaced apex beat. And also auscultate for S1, S2. Remember the murmurs. Can you tell what this is? Ooh, ooh, ooh. It's an ascendo decrescendo murmur. What is that? It's aortic stenosis with radiation towards the carotids. How about this? It's a pansystolic murmur with radiation towards the axilla. It's mitral regurgitation. Remember the keywords also for the diastolic murmurs. The mitral stenosis is a mid-diastolic murmur, and aortic regurgitation is an early diastolic diastolic murmur. I hope you've found this video helpful. For more videos, please visit my website at medics4u.webs.com and also my YouTube channel. Take care everyone and stay safe. Look after your hearts. Luptup, luptup.